This morning, Friday, October 16th, the State Department of Health has reported that COVID-19 cases in Miami-Dade County surpassed 176,100, and 3,520 people in our county have succumbed to the virus. Now, over the last few weeks, there has been a slight but clear increase in the upward trajectory of the disease. The number of county infections has topped 500 for 2 days. The number requiring hospitalization is also trending upward, and the positivity percentage continues to hover around 5% most days, more or less. These trend lines reflect similar trend lines throughout the state, where there seems to be an uptick as well. Whether that increase becomes a surge similar to the one we felt over the summer is unknown. Only time will tell. But I do have a real concern with the approach our state is taking to addressing this virus. It has become very clear that the state of Florida is pursuing herd immunity as its policy for combating COVID-19. Now, herd immunity typically is done with a vaccine, which gives everyone a level of immunity that prevents the spread of the virus. But recently, it is being advocated by a few outliers as an approach to disease management, where its proponents argue that the best way to address this virus is by letting infections spread throughout the population and not mandating countermeasures, while urging vulnerable people to protect themselves. Now, to be clear, this is not a mainstream approach to addressing this disease, and I'm unaware of any other state that has pursued this as its actual policy, but it is clear it is the policy of the state of Florida. On September 24th, our governor hosted a roundtable with a few handpicked experts. These experts, Dr. Jay Bhattacharya and Dr. Martin Kulldorff, argued that mask usage wasn't necessary, that letting young and healthy people get infected was fine, and that reaching herd immunity was the best way to address the disease. The next day, on September 25th, Governor DeSantis unexpectedly opened up nearly every part of commerce, following their advice. Simultaneously, he issued an order preventing local governments from enforcing mask mandates on individuals, again following their advice. And his administration began pressuring school districts that openings were required upon threat of loss of funds. He even prevented limits on large gatherings and reduced social distancing requirements. Now, if there was any doubt as to our state's policy, a few days later, 3 doctors authored a controversial medical statement. They called it the Great Barrington Declaration, where they argued that the best way to deal with this disease was by pursuing herd immunity by letting the virus spread throughout the community without any mandates, including mask requirements. Now, if you think the declaration sounded eerily similar to the orders our governor implemented, you would be right. 2 of the 3 authors of that declaration are Dr. Bhattacharya and Dr. Kulldorff, the same doctors whose advice our governor is following. I have tried to make these presentations factual. While I have not always agreed with the actions of other elected leaders, I've mostly avoided direct criticisms because, frankly, I think my statements to you should be about giving you information, not placing blame. But I want to be clear about our new state policy and what it means. Most mainstream physicians and scientists believe it is an outlier, if not fringe approach. Dr. Fauci responded yesterday on Yahoo News to the Great Barrington Declaration and this approach.
That again is another trap, because when you talk about the Great Barrington Declaration, what they say in there and then what is implied are 2 different things. They say, A, we need to protect the vulnerable. I totally agree with that. No problem. That's apple pie and motherhood. The other thing is that you don't want to lock down or close down the country. I certainly agree with that. I just said that. But in there is the implication that if you just let anybody get and everybody get infected, don't wear masks, let children get infected, let everybody get infected, and just protect the vulnerable, like being really careful in nursing homes and places like that. That doesn't work, because in our community, there's maybe 1/3 of the population, depending upon how you figure it, that are vulnerable and would be prone to getting serious complications from COVID-19 disease. It is impossible, and we've never protected those people in the community. They're not in nursing homes where you can do things in nursing homes. You have the elderly, obese people, people with underlying conditions like heart disease, diabetes, and other conditions. If you let infections rip, as it were, and say, let everybody get infected that's going to be able to be getting infected, and then we'll have herd immunity. Quite frankly, that is nonsense. And anybody who knows anything about epidemiology will tell you that that is nonsense and very dangerous. Because what will happen is that if you do that, by the time you get to herd immunity, you will have killed a lot of people that would have been avoidable. So, I mean, no, there is a certain core group of people that are saying that. But talk at the standard people throughout the country who understand infectious diseases and understand epidemiology, with the exception of the few that you know who we're talking about, they would all vehemently disagree with this idea of just letting everybody getting infected and don't worry about it.
We know this to be true from our own experience here in Florida. Even when we were in full lockdown, the virus found its way into all communities. For instance, we locked down nursing homes, and still over 6,400 nursing home residents have died in Florida, including 13 at a single facility in South Beach. And so many people over 60 or with high blood pressure or asthma, they don't live in nursing homes or on islands. They live with their children or must work in the community or teach at our schools. We have been listening to Dr. Morris, who is the director of the Emerging Pathogen Institute in Gainesville. He explains the concerns with pursuing herd immunity as a disease management tool.
The alternative approach to getting immunity is to simply let everybody get sick. It's this let everybody get sick approach that recently has been going under the name of herd immunity. If people don't get seriously ill from an infection, this can work. And for COVID, there are some people pushing this approach, saying that since younger people tend to get only mild illness, we should stop trying to control spread of the infection in younger age groups and focus only on trying to limit transmission to the elderly or other high-risk groups where serious illness or death occurs. Now, there is a certain perverse logic in this, but it ignores the fact that we live in a multi-generational society where it's been estimated that up to 40% of the population has increased risk for serious illness if infected by COVID. It's not possible to totally isolate older people or people at risk for infection. And in particular, if an infection is spreading rapidly through a population, ultimately the elderly and persons at risk for serious illness will get exposed. And this is what we've seen with COVID. Even when infections are initially concentrated among young people, if there is widespread transmission, infections inevitably spread to high-risk groups, with hospitals filling up with patients, as we saw this summer in Miami. For this reason, there has been virtual universal opposition in the scientific and public health community to the idea being pushed that we should stop trying to prevent transmission and just let people get sick. Here in the United States, it's estimated that no more than 10% of the population has been infected, and we've had close to 220,000 deaths. So just very crude math, if you're going to hit a 70% infection rate, as would almost certainly be required to get herd immunity, we may be talking about 7 times as many deaths as we've already had. Not to mention millions and millions of hospitalizations, ICU admissions, and potential long-term complications in a high percentage of infected patients. Probably not the approach that most people would want to take. So wear a mask, socially distance, and get the vaccine when it becomes available.
Our experts have done some math, and they believe that in Miami-Dade alone, if we allowed it to spread to everyone, it would conservatively cause the death of 14,000 additional people beyond the 3,500 that have already died. That would mean COVID-19 would cause more deaths in our county this year than cancer, heart disease, diabetes, Alzheimer's, strokes, gunshots, suicides, homicides, and the flu combined. Finally, for those who think we need to do this to reopen our economy, I think you're mistaken. Tourism is a prime driver of our economy, but people know when and where it's unsafe to travel. Advertising our state as a place where no one needs to wear masks and the virus is allowed to spread unconstrained is not going to attract people to our restaurants, hotels, and venues. We must reopen, but demonstrating we are thoughtful, following mainstream science, and exercising caution as we reopen is what we need to do. I hope the governor reconsiders this approach, but in the meantime, please wear your masks and follow social distancing guidelines. Have a great weekend. And as always, thanks for your calm, your patience, and sacrifice. Stay healthy and mostly at home.